Good morning, friend. Myself, Dr. Atul, your faculty for injury prevention and rehabilitation. Uh, Today, we are going to discuss part of injury prevention and rehabilitation, sports injuries. In the previous lectures, we have discussed about sprain and strain. Now, we are again going to discuss about the different uh, overuse injuries or acute injuries. How you are going to manage fracture. So, fracture is a acute injury because it occurs with the single episode of any kind of blunt trauma or oblique twist or a sudden trauma. As per the definition, there is a discontinuity between the bone is known as the fracture. Generally, there are two types of closed and the open. When the skin remain intact and the bony the fracture ends of the bone doesn't come out, it's known as closed fracture. And when the bony part or skin is abraded or skin is uh, also affected and the bony part is comes out, then it is known as a open fracture. So there are other methods also of describing the fractures, but here I just discuss the common types of fracture, that is open and closed, and how you are going to diagnose whether fracture is there or not. Many of the time, and generally, the athlete, they are self very intelligent and they are aware of their body, and they themselves has told ki they will tell you, I have heard of some click, or he will give ki I feel like that something is tear off. First thing. Second, when you place your finger and move your finger on the fracture side, you feel there is a disruption or visual deformity might be seen quite oftenly. So, and there might be crepitations over the fracture side, and there will be a mobility of bone. But for that, you require some sort of experience and clinical experience, visualization, and with the history, you can easily make out. And then the movement of that particular part is very painful. It might be deformed also. In the smaller joint or smaller bones, it is very difficult to identify or difficult to diagnose, like small phalanges or metatarsals. And then how you are going to diagnose? For confirmatory diagnose, you can ask for plain digital X-ray or the CT scan. 99% X-rays generally reveal the fracture. Few of the fractures might be missing, like scaphoid fracture. They generally appear after a week or so. So, but for them, CT scan is required. Then comes the initial treatment is quite same. RICE protocol or PRICE protocol. Protection, that is protect from further injury. Give him a rest. That rest means give that injured joint area under the rest. Apply ice, give a compressive bandage, and elevate that area. So further blood effusion or blood loss will be stopped. Then the definitive treatment, if it is a closed fracture and there is no further, you with the help of clinician, you ruled out, okay, there is no muscle or nerve damage, then and in the X-ray it shows there is no displacement, you can put up under the cast, and that is you can put under the plaster of Paris, and for the 4 weeks, and then the rehabilitation is start. And when there is a displacement and the fracture, it's a multiple fracture, then you might be required open reduction and internal fixation. This required a proper anesthesia and required a uh, orthopedic surgeon who can do all these open reduction and internal fixation. And the rehabilitation of the fractures, once the bones are healed properly, then the nearby joints will be start mobilization, and with the help of initially electrotherapy modalities, the joints uh, get mobilized, and the initially we have to achieve the full range of motion, and once we achieve that full range of motion without pain, then we start doing the isometric, then the isotonic, then the strength training exercises, and then the balancing and the plyometric exercises, and explosive exercises. So this is the rehabilitation of fracture. And now comes the overuse injury, that is medial tibial stress syndrome, with though I have covered under the previous lecture also. This is the more common in the runners, those who do running, distance running, and all of a sudden they increased their training load, or without some guidance they have or proper conditioning of their body, they have started running, or they have some sort of malalignment of their lower limb. So the tibial portion of the medial side of the tibia got excessively loaded, and this injury uh, occurred. As I told you, it depends on the age, sex, and the training load, nutritional, and past history. Those who have a past history of some sort of stress reaction, they are more prone for the another one. So once you are already suffered from the stress injury, you have a more chance. So you have to be very careful when you increase your load. So you intelligently increase your load, and always keep in mind the 10% increment every week. That much load you should increase. And while we doing examination for the medial tibial stress syndrome, the medial, the lower two-third and upper, that side between the lower two-third and the upper one-third, it's an acutely localizedly tendered, and sometimes your athlete don't allow you to put your fingers or allow you to touch. Sometimes he is not able to bear weight also if it's converted to the stress fracture, but there will be a small swelling over the that lower two third, the junction between the lower two third and the upper one third. And whenever he start doing some activity or running, walking, he felt pain over that area. And as initially with the activity it weans off, but as if he is not corrected or reduced his training load, the pain will reappear. In the for the definitive, we can ask for the MRI, because X-ray can't judge or give the diagnosis of MTSS or stress reactions. MRI is the MRI bone CT scan. MRI is the definitive investigation which gives you the stress reaction. In the MRI, there is some edema is there, cortical edema is there, and by which in the T2 scan and T1 scan, according to grade, stress reaction to the frank stress fracture also. The initial management for this MTSS is again same, rise and polish. Here comes the polish. You have to protect his and give a optimum loading. You can be allowed, once he is doing his daily activity pain free, then you can ask him to do little bit of walking or cross training, like cycling or swimming or deep water running, or anti-gravity treadmill running. And in this condition, one should be very careful about the use of NSAID, that is paracetamol, brufen, the other available, easily available painkillers. These painkillers hampers the healing process also. So one should not take painkillers or non-steroidal anti-inflammatory drugs too long. But if in the beginning pain is there and he's not able to cope up or with the pain, taking pain non-steroidal anti-inflammatory drugs like paracetamol 650 mg twice daily will be helpful, and it helps to reduce the inflammation also, and at the stress reaction site, and relief from the pain. But if a person is taking these paracetamol or any other anti-inflammatory non-steroidal anti-inflammatory drug for a longer duration, then it hampers the healing process also. So one should be very careful, and he has to maintain his diet, his hydration, his he has to take vitamin D supplementation and calcium supplement also. So the healing process uh, of this stress reactions will be fast. To expedite the healing process, we can use various electrotherapeutic modalities like uh, low intensity ultrasound therapy. We by it helps in the healing of the stress reaction by remodeling of the bone. And we should start early range of pain-free range of motion, so the adhesions in the joints doesn't form. And for we can start cross training, then the deep water running, anti-gravity treadmills, and the same protocol for the isotonic, isometric, and the stability exercises, like your pelvic girdle stability exercises, all the four movements which generally occur your glute area, that is flexion, extension, abduction, and adduction. You have to stabilize this, and then the your knees, calf muscles, and your thigh muscles strengthening exercises, and simultaneously you have to do is, stability exercise for the your ankle joint also. So after doing all these, we can successfully rehabilitate your athlete or yourself from these overuse injury, and we can overcome from these stress injuries or the overuse injuries. Thank you so much, friends. Now I just briefly summarize the entire sports injuries. So sports injuries are not different, but sports injuries which generally refers as the overuse injuries, which are common in the person who is involved in the sports or the regular exercise. They are same acute and overuse. There are the examples of the overuse injuries and the acute injuries, and how we can prevent these injuries by follow the rules of games, by the playing intelligently, by doing proper warm up, by wearing protective gear like wearing knee cap and ankle brace or knee brace, wearing your elbow brace, correct size of your gloves while playing your golf, and choosing correct grip for the racket sports, and timely change your shoes and your gears. So don't play with the wear and tear or low quality gears. Include plyometric and proprioceptive exercise, so your body or your mind should be aware ki, where is the position of your various joints, and maintain the proper hydration and nutrition. If you are dehydrated, chances of injuries will be more. If you are not properly nutritionally good, then your healing of the injured muscles with every exercise, some wear and tear occurs, that will not be healed properly, so uh, you will be prone for the injuries. And when your important competition is there, so do your activity intelligently so you can save yourself for the bigger competition, and plan your activity in advance. The common concept of during the uh, mm, playground is rice, that is, or price or polish. Polish is the advance, but price is protection. Then the rest of that injured part, protection means you have to protect him for further injuries. Like, you have to take him out from the ground, give the rest to the injured part, apply ice, and then give him a compression bandage and elevate that injured part. In the polish, uh, there is a protection, then optimum loading is required after acute phase, then the icing, compression, and the elevation. Why the overuse injuries occur? The example are the stress fractures, tendinopathy, instability, which I have already you in the table there are there. And these overuse injuries, most common are the stress reactions or stress injury of the bones. And why these occurs? Malalignment of joints, limb length discrepancies because of age, sex, and race. Some are more prone, and few persons are less prone. Then the hard surface are more prone for these stress reactions. Training, so all of a sudden, if you give excessive training load, then the chances of injuries are more. Than the faulty sports care. The modifiable factors for the bones are the biomechanical, training, surface, sports, and the muscle factor. Uh, And the factors which resist for the fractures are the energy availability, calcium, and vitamin D, and training history. And how you diagnose? By the examination history. There must be history of your overuse, and with the help of investigations like x-ray and mri. Mri gives you a clear cut picture under either T2 images or in the T1 images. There will be a edema, cortical edema, in the MRI images. And how you are going to manage him? Initially with the activity modification, and identify the modifiable risk factors, and then the return, how you are plan to return for activities, beginning with the progressive initial running. If the consecutive 2 or 3 sessions are pain free, then you can increase with 10%, and simultaneously change the uh, if there is some biomechanical fault, you can change that. But keep in mind this change will not initiate the other problem. Rehabilitation is depend on the type and site. The basic principle is uh, passive. Begin with the passive range, pain-free range of motion, then the active, then the isometric exercises, then the isotonic, and then include the proprioceptive and the plyometric exercises, and then in the last, the game mimicking exercises and game specific training. And return to sports, it decided by various tests, which is the specialized test, which will be conducted by the specialist doctor, and with the help of biomechanist. And when you are doing rehabilitation, or you are asking some athlete for this rehabilitation, you must ask him to motivate himself, or take a session of a sports psychologist. He will motivate him, so there will be no negative feeling of his rehabilitation or his injuries. So sprain is a injury of ligaments. Ligaments are the collagen bundles which binds two joints, and their injury, the common example of the ligaments are anterior cruciate ligaments and supraspinatus ligaments of the joints, and the ligament of the ankle. And same principles of the like polish and price and rehabilitation. If you go under surgery first, the optimum loading principle will be affected there, and your pain-free range of motion, then the isometric, then the isotonic, and same sequence of, and it takes minimum 4 to 6 months. Strain is a injury of muscle or oblique tendon, and same the affected muscle oblique tendon. If it is a complete tear, it required surgery and then the proper rehabilitation. And if it is not a complete tear, it okay, still it requires rehabilitation uh, of few weeks to few months. And same principle of polish and price. And fracture is an acute injury, and it's in two types: acute and open and close. And it requires some time it's a close reduction, and sometime it requires the open reduction and internal fixation. And rehabilitation depends on the uh, which type of if it is a closed direction and there is no complication, then rehabilitation will be, one can return to play within 6 to 8 months. And if it is open reduction and internal fixation, it may take a longer duration. MTSS, it's a chronic injury or overuse injury of the lower limb, or it's again depend on the age, training, and mostly on the training load, and your malalignment or your alignment of your bony structures. The diagnosis depends on the MRI. There will be a edema on the cortical surface, and the management remain the same. Price and polyp price rise, and you should be very careful while using normal non-steroidal anti-inflammatory drugs. Don't use more than a week or more than 3 days. After 3 days, generally pain subsides, and you can start walking, or you can doing non-weight bearing exercises, and you can start doing cross training. And we can use for the fast healing low intensity ultrasound, and partly pain free range of motion, initially without then the weight bearing, and then the cross training. And for cross training can use cycling or swimming, that is deep water running. And if the institute is good enough and that has a anti-gravity treadmill, then we can use anti-gravity treadmill also. So thank you so much. Now it finishes your 6th week. Thank you so much.